the floor of the female. So that's this area right here, and it's showing you this triangle here where you can see this whole area is called the vulva, or you could say pudendum. Okay, and on this floor you can see the clitoris here. You can see the prepuce, that little hood right there is prepuce. Okay, you can also see this is the vagina, and this is going to be the anus area here. Okay, you can also see the muscles that surround this area. This is your muscle surrounding that area. So you have the bulbospongiosum and the ischiocavenosus muscle. So this is the ischiocavenosus, because that makes sense. That sits right there near the ischium. And this is the bulbospongiosum. And during an orgasm, these are the muscles that are twitching in rapid succession. And they're innervated by the pudendal nerve. You don't have your pudendal. Okay. Now, this is your labia minor here. And now this area right here is the greater vestibular gland. So this is the bulb of the greater vestibular gland. Now this secretes mucus to keep all this area nice and moist. Okay, keep it nice and moist. So then when you're looking at this model right here, this is just showing you that outer lip. That's your labia major, and that's your labia minor. And all of this area out here is called the vestibule, or the welcome mat. Is that on it? No, that's not on it. Okay. So then you leave this area, and then, of course, ladies, this is the vagina. All this is the vagina, and that's your cervix. Now look at that cervix. The cervix has an anterior fornix and a posterior fornix. So these are little clefts that sperm can accidentally go up in, and they stop there because that doesn't take you through the cervical canal and into the uterus and on out. Okay. So when you look at the actual uterus, and I kind of went over this earlier. Well, let me show you the fimbriae first. So this is the uterus. All of this area here is the fundus of the uterus. So all this is fundus. Fundus. Out here is the perimetrium, the myometrium, and the endometrium. And you can see this one has a fetus in it, growing. All right. And you can see the placenta. Now, over here, this is the ovary, ovarian ligament. So right at the very end of the ovary, you see all these little hairs right here? That's fimbriae. Fimbriae. And fimbriae will beat gently right after ovulation. So when you ovulate, it'll start to beat like this to draw the egg up into the fallopian tube. So the egg just doesn't drop down in the peritoneum.
Oh, okay.
Okay, so without that fimbriae, you can see a real good right there too. Without that beating, it kind of gives it a little wave and calls it up into this area.
So it's at the end of what? The fimbriae is?
The fimbriae are hair-like projection, and when you ovulate, right at day 14, or whenever you ovulate, everybody's different, but day 14 is the nice, safe number, because that's the number I always see. These will start to gently beat. So when you ovulate, when you release that egg, it'll start to beat to draw it up into the fallopian tube, which is kind of cool. So as the egg travels down the fallopian tube is actually divided up into regions, and that is not on there. Okay.
So it's at the end of the fallopian.
Yeah. So, okay, we're going to talk about the regions here. But all of this is the body, and this is the fundus. So the isthmus is right here, right there. As the fallopian tube reaches the uterus, you have an opening there called the isthmus. So the isthmus is the connection from the fallopian tube to the uterus. Okay? So it connects at the isthmus. So, okay.
That would be that right here?
Yes, right there. So on this model, that's not really showing that. Okay. All right, now we looked at the cervical canal. Now, with the cervical canal, you have two structures. Okay, this is still vagina, ladies. This is still vagina. Now you can see the cervix very nicely here. You see the anterior fornix, posterior fornix. Now, right here, you're going to have an external os. And up here, you can see the internal os right there, internal os. The os closes off this area right here when you're pregnant because this will fill up with a mucus plug. I think everybody's heard of a mucus plug. That mucus plug will fill up this cervical canal in between the oses. And it'll hold that pregnancy, okay, until it's time for the birthing process. Okay, now we talked about vestibule, greater vestibular gland, bow. Now, rectal uterine pouch, vesical uterine pouch. Those are spaces. So it'll be better for me to show you that on this model. Or this one is fine. Let's do this one because it's sitting there. Okay. Notice how the uterus is sitting right here on top of the bladder, right in front of the rectum. You see this space right here? That's your rectal uterine pouch. That's an actual space in between the rectum and the uterus. So vesical uterine pouch is the space between the bladder and the uterus, right in there. Okay? Now, this is bladder, and of course this is the urethra here. That's your urethra. Okay? So on this model, you see the clitoris here, the urethra here, and then the vagina, and then that's your anus. Okay? Now, the clitoris is very important to females because this is just like the penis. They're analogous, similar structure. So when a female is aroused, this gets nice and stiff. Now, in some countries, some third world countries, they actually cut the female's clitoris.
It's horrible. It's terrible.
It's just terrible. So they can't really enjoy that whole sexual process. And then I want you to notice this, lady. See that little line? That's the hymen. Right there. And that's supposed to cover over that area. Cover over the vagina area until you're ready to be sexually active. Now, have you heard of people having that replaced? I've heard of